Hello everybody, my name's Linda Stockwell and I'm Head of Physical Healthcare at Lincolnshire Partnership NHS Foundation Trust, and these are my colleagues.
Hello, my name's Jackie. I'm one of the physical healthcare practitioners.
Hello, my name's Sarah. I'm also one of the physical healthcare practitioners and the Trust Resource Officer.
And what we're going to do in this short film is tell you about our 90-day NHSI project, the Closing the Gap Collaborative, and about how we improved an aspect of physical healthcare for our patients or people that are living with serious mental illness. So behind us we've got this poster. Hopefully it's a bit bigger and you can see it in the room there with you. But what we decided was that we do a project that's looking at diabetes care, and then we realised, wow, that's massive, we can't do all of that in 90 days. So we slimmed it down to making sure that everybody who is a new admission as an inpatient to LPFT would have their blood sugar checked within 24 hours of admission. And we started working with the PDSA cycles to see how this project could be developed and embedded.
I found the PDSA really difficult to begin with. I've never done anything like this before, so it was really interesting to learn more about it and to find out what is needed to do a project like this.
Similarly to Jackie, I'd heard of the PDSA cycle but never actually had to do one in practice. So I found it a really helpful, structured way to look at what we could do and rethinking about different ideas of how we can implement our objectives.
The other thing that we were really keen on was to make our project collaborative, like it says in the title, and that was something that we took really seriously, and certainly it is the ethos of Lincolnshire Partnership that we work collaboratively with our patients, with their families, with the carers and with staff.
To us it's really important to have that peer support involvement and patient involvement. We're really fortunate to have Rachel, who is our peer support. She's been on board with us in a number of physical projects that we've done within our trust, and she's unfortunately got diabetes of recent, and so having that experience of what it's been like for her, and how she expects patients to be treated when they come into our trust was really an important aspect of the project.
We designed our project using a driver diagram, and we set ourselves some objectives, and we did find that we had a couple of hurdles that we weren't expecting that caused us some challenges around data collection, and that was the introduction of a new clinical system called Rio, which actually is providing us with some really great data about our patients' physical health and how we monitor it. We selected 2 wards that were completely different, and we looked at how many patients had their blood glucose checked within the first 72 hours, but we streamlined that for our project. We monitored this data, and then after a set amount of weeks we intervened.
So the interventions were staff training and communication, and throughout doing the PDSA cycles and then bringing that work into practice, we were able to identify that actually there was various gaps in knowledge and skills amongst the staff, in terms of physically actually taking the blood glucose. Some staff felt that they didn't have sufficient training. Some staff didn't feel that they would know what to do in the event of an abnormal result. So it was really interesting identifying that and looking at ways that we could resolve those issues.
And what we have noticed is the other interesting information that's sort of fallen out of our project around, obviously we're big fans of parity of esteem for our patients, and we were finding actually that our inpatients didn't get the same diabetes care as perhaps our patients in the community did, or other colleagues in acute care. Therefore, this has started us on another mission to make sure that our patients get the diabetes specialist care that they need and that they deserve. That's really important to us. project has given us some really good data and left us with the questions, what next?
So as a trust and as a physical healthcare team, we've been fortunate enough to be involved in the Lincolnshire Diabetes Network, which is a multi-agency programme looking at diabetes care throughout the county. And as part of that, we have sought some links, and we are now able to start referring our patients through the National Diabetes Prevention Programme, which is fantastic. That we do need to, look at how we can support this for all of our service users and patients, but at the moment we're trying to identify those that will benefit from this right at this time.
Okay, thank you. So Jackie, why is this important that we give our patients the best care that we can?
It's really important because it fits in with our physical healthcare strategy for 2018-19, which is really important to us.
Okay, so hope that's given you an overview of our project. We're happy for you to drop us any emails if you've got any questions, and we'd love to share this work with you. If you like it, feel free to pinch it with pride, and thanks for listening. Hope you have a really great day. Bye!
Bye.